1.
Good morning. This morning we're going to do an acupuncture demonstration along with needling some ashi points. And if you don't know anything about acupuncture, I'll bet you know about needling ashi points because in Western medicine, physical therapists are referring to that as dry needling. And all that means is that we use an acupuncture needle, a filiform needle that is not hollow and doesn't have any drugs or anything in it. So it's dry needle. So I've already started with this patient to insert his acupuncture needles for some back pain. This gentleman has a history of headaches that originate from this left shoulder and go up around the ear to the left eye. And it seems like the major malfunction there is that he's got some massive trigger points, some knotted muscles in his levator scapulae and the top of his trapezius muscle. And it refers that pain up until in his head and neck. And so as part of his acupuncture treatment, we're going to do some dry needling. So come in a little closer so you can see. And you'll see I've already got some needles in there. And all I'm doing is feeling for that trigger point under the skin. And he's got kind of a golf ball sized one right here. So I'm going to needle right into it. And then when it comes to dry needling, we're simply going to plunge, bob, and spin the needles in and out. You might see a different, you get a little twitch from it. You might see a different demonstration if you see like a physical therapist doing this. But I was taught by a Chinese acupuncture and TCM master, and so this is all part of Chinese medicine and acupuncture, and this is how we manipulate the needle in that trigger point. And what happens as I'm doing that needle manipulation irritates those muscle fibers in a way that it breaks them up. It makes them relax and break up. Now, physiologically, what's probably happening is that we're irritating the muscle and attracting some endorphins and also some special types of blood cells like phagocytes to eat up the damaged tissue. But what the patient feels is relief. And I think we're on record here. Steve here hasn't had a headache for how long? Month and a half, which is a record for him. We've worked out the triggers on the other side. So that is it. Now you've witnessed dry needling. Tell all your friends. Thanks.